Warning: this podcast does not introduce any new information outside the Foundation's curriculum. Listener discretion is advised.
Hey there, friends and curious minds tuning in. Welcome to another episode of Real Doctors, Real Friends, the podcast that takes you on a behind-the-scenes tour of the world of medicine, one episode at a time. My name is Dr. Roshan Abraham. I'm a family physician and faculty here at the University of Alberta. Whether you're starting your pre-med journey already knee-deep in med school chaos or simply fascinated by the mysteries of healthcare, you've landed in the right place. We're thrilled to be the first official podcast affiliated with the Faculty of Medicine and Dentistry in Canada here at the U of A in Edmonton, Alberta. Our goal is simple: to create a space where we can explore the most pertinent topics in healthcare, whether you're a current med student, a hopeful pre-med, or just someone curious about the field. This podcast is for you. And let's be honest, staying up to date with healthcare news is more than just cramming for the MMI or preparing for exams. It's about understanding the ever-evolving landscape of medicine and how it affects our future as physicians or even med students. Plus, for all you pre-meds out there, this could be a great way to prepare for those big interviews by diving into real-world topics that matter. So sit back, relax, and let's make this educational journey a bit more fun and a lot less intimidating. Joining me is my co-host, Dr. Shereen Hamza, who can probably teach physiology in her sleep, as we've mentioned now for the umpteenth time. Our other usual podcast host, Shazma Mithani, a second-year medical student at the University of Alberta, is traveling and unable to make the recording of this podcast, but she will be back and ready to give the medical student perspective on all the topics upon her return. Shereen, how are you doing?
Hey, Roshan, I'm doing great, especially since we're tackling a topic that's both timely and essential, the ER crisis. It's something that affects us all, whether we're healthcare professionals or patients. I've been thinking about how emergency departments are like the front lines of a battlefield. It's intense, chaotic, and demands quick thinking and resilience.
Absolutely. The ER is like the ultimate test of medical skills and emotional endurance. It's not just about diagnosing and treating, it's about managing a constant influx of patients, each with their unique needs and emergencies. It's like trying to solve a puzzle, but the pieces keep changing shape. The pressure is immense, but it's also where some of the most profound moments in medicine happen. And that's why I'm so excited to have Dr. Shazma Mithani with us today. Dr. Mithani, you've been in the thick of it, especially during these challenging times. We're thrilled to have you on the show. How are you holding up with everything going on?
I'm just still impressed with how well you described emergency medicine right now. Yeah, it's been a really tough time. So it's up and down.
Yeah.
Dr. Mithani, thank you for joining us. Emergency medicine is such a challenging and dynamic field. I'm curious about what inspired you to pursue this specialty. You know, it's not every day that somebody might willingly step into a job where adrenaline is part of the daily routine. So was there a particular moment or experience that drew you to this specialty in particular?
I think a big piece for me is how diverse emergency medicine is. So as I went through clerkship, everything I kind of rotated through, I really enjoyed all of it. And so whether it was general surgery or obstetrics or internal medicine, I was like, oh, well, I want to, match to this in residency, or I want to match to that in residency. And then it wasn't until I did my emergency medicine rotation in my core rotation where it honestly just felt like home. Mm-hmm. It sounds really cheesy, but it felt easy. It felt so interesting. And every single person you see, you have no idea who you're going to see next. Mm-hmm. Like Roshan mentioned, it is like trying to put a puzzle together with moving pieces or changing pieces all the time. And so just being able to use my brain in that way was just very appealing to me. And that's kind of how I landed on Emerge.
Which would be scary. For a lot of people, that would be something that's uncomfortable and wouldn't really feel like home necessarily. Mm-hmm, but it's interesting that you like that. Yeah.
And it's not just about the adrenaline rush. There's a certain allure to being the first point of contact, the one who makes life-saving decisions on the fly. It also takes a special kind of person to thrive in that environment, which is so true. What made you choose this path over other medical specialties? And were there other specialties that you also found intriguing or still do?
Yeah, I mean, it's sometimes a balance between surviving and thriving, I would say. As I mentioned, there were I really remember enjoying general surgery. When I went through Gen Surg, I enjoyed the tactile aspect of it, being able to use my hands, being able to problem solve in that way as well. so that was one that was kind of high on the list for sure. And internal medicine was high on the list too. And the nice thing about Emerge is it really is a balance between procedural medicine and medicine, like brain medicine, I guess. Like what's the opposite of that? I'm not sure.
Because in surgery, you don't use your brain.
Like putting things back together versus trying to solve what an underlying issue is. And how
So
to
like
treat
investigative medicine and procedural medicine, like those two things really are part and parcel of what Emerge is. And so like, yes, there's the adrenaline piece. And I think that, the media, for those who are pre-med students, and then the general public, the media portrayal of what emerges is really not accurate in terms of what is actually happening. And so it's not just like, typically, it's not just sick patient after sick patient after sick patient coming in. I mean, that certainly there have been times especially over the last 5 years where it has been like that. But it is a mix of very diverse patients where like, some people can wait a bit longer. Other people need to be resuscitated immediately. Right. And so it's not always, resuscitation after resuscitation, but you do need to be able to thrive in that environment for sure.
I'm really glad that you mentioned this last point. So it's probably not all drama and chaos. There seem to be moments of calm from what you're describing. Can we say that?
I would say it's not always constant moments of resuscitations. It's like constant controlled chaos. I'll put it that way. It's constant controlled chaos and definitely no moments of calm or sitting. I feel like I'm kind of always on the go and trying to kind of figure out, whether it's the next patient to see that's physically in a room or trying to like figure out how I'm going to move things around in a way that I can help get people out of the waiting room when there aren't places to see them. So it's constantly this evolving, changing, moving environment where we're on our feet trying to figure out the best way to see the patients that we need to.
Would you say that it's always very serious, or are there moments of levity?
Thankfully, there are moments of levity. And a lot of those are, I think, moments that we have to create ourselves too. In the way that we interact with patients, in the way that we, even build the dialogue with patients, having those personal connections. And if the time is appropriate, making a joke here or there just to, help them relax a little bit, make it through. And then also like just to remind ourselves, like these are humans in front of us as well, right? So, and then even like, as a team of healthcare workers, like there are devastating moments that happen there with us all the time, every day, regularly. And so we, as a family in the emergency department, really do try to find the like little moments of joy and connection that we can to be able to even just like get through a shift.
Yeah.
So based on what you've described, what is it about emergency medicine that keeps you coming back day after day, despite the challenges?
I think...
Or can you even pinpoint something that brings you back?
Yeah, I think in general, it still feels like I'm helping people. At the end of the day, it still feels like I'm having an impact on people, despite the, crumbling system, the system challenges, how under-resourced things are. I really try to look at things at an individual patient-to-patient basis, because if I look at things or pay too much attention to the system-wide issues, it is really challenging to find wins in that. And then it becomes really hard to come to work in that context and continue to be positive about that. And so, and of course that does happen. Like it's hard not to think about the system challenges, but when I'm at work, I try to just look at it on a patient by patient basis and like what individual impact I can have on each person that I see in a stretcher. And focus on those small wins. Yeah.
Not to jump ahead too much, but I've always been struck from the start of med school as to how many emerge docs are actually involved in system level advocacy, though. Right? Like it was one of the first things that I noticed. To be fair, Dr. Louis Franciscetti was one of the first people that showed up and gave us this very, I would say, life-changing talk for me. And it made it very clear, at least to me at the time, that doing emerge, if you had a certain mindset or certain outlook in life, then you would be very much inclined to look at advocacy at a system level because of what you see on a regular basis.
That's absolutely it. And I mean, the way that I see emerge is that we have a very unique view of the entire healthcare system. We're right at that interface of community care and of acute hospital care. And there's no other specialty that is placed in the system that way. And so because of that, we feel the pressure from the community side when people don't have access to primary and community care. Yeah. We feel the pressure from the acute care side when things are over capacity and we can't move patients out of our emergency department. So we really feel the crunch on both sides. And because of that, have this unique view of the healthcare system. And then this unique ability to advocate for it in that way, because we can see where the pressures are, where the levers are, what kind of needs to be done in order to continue to improve the healthcare system. And so I think because of that, because we lie in that interface, it pushes us to advocate. We see the direct impacts in the patients in front of us and our ability to manage the patients in front of us because of all those system challenges. And so we're, well equipped and well positioned to be a voice for our patients in that space.
Now, given the current situation, bring us back to the present. Can you give us an overview of what the ER crisis is looking like? How has it been exacerbated by our respiratory virus seasons, I would say, especially over the last few years? And we've been hearing a lot about overcrowded emergency rooms and long wait times, which is not necessarily a new thing. And what's really going on behind the scenes? Lots of questions there. So I'm more than happy to repeat those in the future. Yeah.
Yeah. I think if we rewind back 5 years, kind of, let's say pre-pandemic,
right.
Okay. At that time, there were certainly system pressures in the entire system. Wait times were an issue. Even if we rewind 10 years prior to that, like there have been times in the system where wait times have been very challenging. And then we, invest in healthcare and improve things. People get access to primary care. We improve things and things get better. The problem with kind of the pandemic, there are lots of things that were bad about the pandemic, but in terms of emerge and system level stuff, because people were not going to get care, people were losing their family doctors because of other political pressures that were taking place. That lack of primary care created this care deficit. And that care deficit has been challenging to catch up to. It's been growing massively. Access to primary care has continued to dwindle. And we all know how important primary and preventative care is, right? Yeah. If everybody has access to primary care and their hypertension or their high blood pressure is managed, their diabetes and heart disease are managed, they are not going to need to have to come into the emerge as much as it is, right? So the lack of primary care is adding to that pressure, and people are getting, not having their chronic medical conditions looked after. People are getting sicker as a result of that. So then more people are coming into emerge. Those sicker people, there's a higher admission rate. So more people need to be admitted. So then, on the acute care side in internal medicine, for example, those patients are staying longer because they're sicker. We can't actually get them out of the hospital, either back home or into long-term care. And so it's this constant buildup that's been continuing to grow over the last 5 years without any investment into the system, but then also things actually being removed from the system, right? So we have human resources that are being removed from the system. We have funding that has been removed from the system, and people are getting sicker. And so it has just been this snowballing cumulative effect where it continues to get worse and worse. I think saying the system is going to crumble is actually the wrong terminology to use now. It has crumbled. We are in crisis. Right. That full stop. We're here now. And it is being propped up on the backs of all the healthcare workers in the system right now. And I think that if every day we didn't come to work and decide to, first of all, be there, and then second of all, try to MacGyver
be as resourceful
things, as possible. This is the public would see a very different healthcare system. Right. And it's important, I think, to remember that that's all on the backs of the healthcare workers that want to make sure our patients don't suffer as a result of all of these things that have accumulated along the way.
We can even extend it to public health perspectives and issues to do with accessibility and so on, that to prevent people from developing chronic conditions in the first place, that would require a greater dependence on primary care and so on. So,
or even before primary care. A lot of the reason that I'm in the social media space like I am is because health literacy, right? Like people need to, people I wish that there was some way from even a very basic public health standpoint for people to be well educated and well informed about different health matters, because one of the other pieces that, like, yes, there are sick people, but then yes, because there's no primary care, the only place for people to go is the emergency department, right? And so, like, that lack of health literacy is also a really big challenge in terms of being able to help make the population healthier and help decrease utilization of the system.
Yeah.
I think you're our first guest that has talked, I mean, over the last 2 years since we started having guests, the first one to talk about health literacy. It has been painfully obvious to me as a family doctor since really starting practice, not so much residency, to the point that I was actually even considering doing some work from a scholarly standpoint around health literacy, because in medical education, health professions education, there's very little that explores how we actually improve health literacy at a primary care level, tertiary care level. And it is massive. Explaining to someone how heart failure works.
Yeah. And it's not,
why
and like,
it's important to follow what we're asking them to do.
Exactly. Yeah. And that's like that blame is not on patients in any way. That's on us. That's on us at, like, at a system and public health level. We need to figure out a way to improve knowledge translation and health literacy to the general public, because, like, we all need to be a part of the solution together.
Yep.
And remove the misinformation or disinformation from the public space.
Which is a new issue, right? That, I mean, when I was going through training was just starting to crop up, but not nearly as concerning as it is now.
Especially with the power of social media and the reach that it has. Yeah. So it's been a really tough few years with COVID-19 introducing additional chaos. But at least from my perspective, and I could be wrong, it seems like every flu season is like a mini COVID scenario. What's the reality on the ground? So how do emergency rooms cope with the double whammy of a pandemic and the usual seasonal influx of patients?
Yeah, I mean, it's really, really challenging. And in particular, this last couple of years, the specific challenge with the, rising acuity of patients, with patients being sicker, even off season, like off the respiratory season. Like, so again, if we go back about 5 years in the last kind of, like, before the pandemic, summer was a slow time. People didn't, like, kind of come to the emerge as much. The volumes were lower. The inpatient wards were not as full. We're entering the respiratory virus season already over capacity, which is very, very scary, if I'm being totally honest, because we know historically every single flu and virus season, those pressures add to the system in a significant and tangible way. Where we get increased volumes, we get increased admission rates because of, like, whether it's influenza or COVID or other viruses. Both of which are vaccine preventable. Just going to put that plug in there, where we will get higher volumes. And so if we're already starting at overcapacity and then we have this big influx of patients coming, it's going to be a very challenging fall and winter.
Right.
And then all of this from the standpoint of stress on the shoulders of our healthcare workers. So you mentioned this about how pretty much we all have to mobilize together or just as individuals, as a large group, to try to prop the healthcare system up. That puts immense amount of stress and on teams, right? We all work on teams. I mean, I work in probably a slightly smaller team than you do, even though we're trying to expand team-based primary care. And even at our academic clinics, even though we strive towards team-based care, it's still a very small team. But I think about, with the constant influx of patients, the constant stress, how does the team and you manage? How do you manage the workload?
Yeah, it's really, really hard. And if I'm being totally honest, like, I actually don't think that it's fair that all of this is on the backs of healthcare workers. It's not our job to fix the system. It's our job to see patients, right? It's our job to see patients, to treat them and have the resources that we need to do that. It's actually not our job to fix the system. We can advocate for it, but those are two very different things, right? And unfortunately, I feel that the goodwill of healthcare workers continues to be taken advantage of in this ongoing, like, system struggle. And so, kind of to answer your question about, like, how it is, I mean, it is, like, it's so hard. Like, every shift is a conscious decision to go there and be positive about things. And then I just came off a string of 3 shifts over the last few days. And when I go there and I see that the waiting room already at 6 a.m. has 40 people in it, how do you come back from that, right? How do you maintain a positive attitude when you know that there are 40 undifferentiated patients in the waiting room who haven't been seen by a physician yet, who haven't had anything more than a quick story from the overwhelmed triage team and a set of vital signs. And like, there could be people like getting sicker and worse in the waiting room. And then on the, you know, other side of the waiting room where we're in the department, like, you know, I showed up to my shift at 6 a.m. on Saturday. We had 40 in the waiting room. We had 10 people in EMS stretchers in the hallway. We knew that we had no internal medicine beds until like discharges like were actively trying to happen by our like amazing internal medicine physicians who are trying to like do their best to see consults, to go upstairs and like do discharges so we can help move people out of the ER. That's how we started at 6 a.m. on a Saturday. You don't catch up from that, right? Yeah. And so as much as, you know, we try to go and be positive and like, you know, put our heads down and work and try to have those like human connections that like give us the bits of joy in the day, it is really hard right now. It's unless you're in it, it's really challenging to illustrate how much moral injury there is associated with this when we can't do our jobs, which is helping our patients because of system challenges and inflow and outflow challenges that are all, again, related to system issues. It's really hard knowing that there are people that are getting worse that likely will have different outcomes because we can't treat them as efficiently and as effectively as we want to be able to.
Yeah. So in addition to the patient load and the factors that you described, can you give us some examples of other limitations? So when we say that resources are stretched thin, besides personnel, what other examples are there just for our listeners to understand?
Yeah. So, I mean, the biggest one is human resources, whether it's physicians or nurses or respiratory therapists or unit clerks or, you know, service workers, like everywhere. And every level of human resources is stretched so thin. Infrastructure resources are a big challenge right now as well. I mean, I work at the Royal Alexandra Hospital, which is a big inner city hospital, one of the largest in Western Canada, and one of the busiest in Western Canada. And there are times where we like have equipment that isn't working. And we, again, like need to use hallway space to have like patients there so we can get crews back out on the road, like EMS crews back out on the road. Right. And so the other challenge is just like the logistics of the movement of patients throughout the system, both from an infrastructure standpoint, but then also just from the pressures that I talked about before.
Are there limitations in supplies or medications as well?
So, yes, sometimes, and especially throughout the pandemic, right? Like we have been getting, I mean, and they've been public warnings to like where it's hit the news and the media, where there have been different medication shortages and then we have to either have pharmacy make things for us, which then takes time, right? Or, you know, dilute or mix things in a different way so we get the concentration of a particular medication that we need. Or in certain situations, like there were some antibiotic shortages in the last few years where like we have had to actually choose different antibiotics that are not the first line because we simply don't have access to the ones that we need because of a global shortage of these things.
Yeah. Wow. I mean, can I just stop and say thank you to everyone? I mean, I guess that includes me too. But
thank you.
I think it's really important for us to just stop and realize every time we hear about the system crumbling, it really, I don't know, it's always been a struggle for me to hear that because, especially over the last few years, because it's already well on its way, like over the cliff. And especially with some of the decisions that we've seen made around public policy and health over the last few weeks or months. Something came out yesterday that just absolutely blew my mind about how our healthcare system, especially in Alberta, is rapidly changing. And I think it's incredibly important to just stop and say thank you. I mean, we have students most likely, and this is going to be going out to a lot of different people, but we have students actually who are starting their medical careers and have actually jumped from another health profession because of the pandemic. In our first year of starting foundations, I don't know how many previous health professionals that I had seen go through that class. It was a ridiculous number. Like compared to I had like one pharmacist in my class or like a handful of nurses. This is like 5 pharmacists, 15 nurses, right? Like a lot of people who have sustained immense moral injury, over the course of the pandemic. And hoping for something better in medicine. And it was, I mean, it wasn't surprising at all, but it definitely hit me as to how bad the system was and what it was doing to people's decisions about what they're going to do for the rest of their life. It was wild to talking to some of these students who are now going to be graduating next year, actually. Yeah. So we can understand the overall emotional toll, dealing with life and death situations. How do you and your team keep your cool or stay focused?
That is something that Emerge has a lot of training in, thankfully.
Okay.
So as we go through residency, so I did like the Royal College residency where I did 5 years of emergency medicine training, having all these amazing mentors along the way to help, because like there are things that are really bad that come in, right? Yeah. So like people who are either dying, who we have to try to resuscitate, or actively trying to die, or like just devastating, terrible situations where we are trained so well to turn that side of our brain off and just focus on this. These are the medical things that have to happen in front of me. This person's bleeding. I have to do X, Y, and Z, right? This person has been, this person has difficulty breathing and can't breathe. I have to, ABC, like whatever, right? Like we are so trained in that immediate resuscitative care where we have like gained this ability to like turn that side of our brain off, like I said, and just like focus on getting what needs to be done immediately to help intervene and save someone's life. That's actually not the hard part of emergency medicine. The harder parts of Emerge are, like the patients who are not dead or actively trying to die in front of you. It's the contextual pieces of that, right? Like when someone's family member is like screaming outside the door because their family member is dying, right? Or now so much like the cancer diagnoses that we're giving in Emerge. Like I just can't even tell you how many like people are, because there is a lack of access to primary care, we are diagnosing so many more people with cancer in the emergency department. That is not a place that you want to get a cancer diagnosis, right? You just don't. And like I have cried with families when I've had to give that news. Those are the harder parts of Emerge. It's not the resuscitative care. That's just like the stuff that gets my adrenaline up. I actually enjoy just like being in that moment and feeling like I am a good doctor because I feel like I know what I'm doing. I know what medications I need to do. And like sometimes it works, sometimes it doesn't, but I can say at the end of the day that I literally have been able to do everything that I could in this situation. When we go to the other things, like whether it's family or, devastating diagnoses, trying to manage like, pain or chronic conditions, again, because of a lack of access to primary care, those are the ones that are more challenging to manage and to feel and to carry.
Yeah.
I remember the one and only time I gave a cancer diagnosis as a resident, like in Emerge.
Yeah.
And when I started hearing from my colleagues on the news about how many cancer diagnoses are given in the Emerge, I just went back to that moment because I will never forget that moment ever. And the fact that is happening on a regular basis,
multiple times a week. I
remember the look on my patient's face. I remember how I felt. I remember all of it like vividly compared to almost anything else I did throughout my Emerge rotations. That's not a place you want to have a cancer diagnosis explained to you.
Yeah. There was something you mentioned about you can turn the emotional side of the brain off in those high pressure situations. In your experience, did you find that was something that came naturally to you? Thinking about the early stages of your career when you're first being exposed to some of these situations, or was it something that took time to develop?
I think there was a part of it that was natural, but then over time, like kind of learning to compartmentalize things, which is not a good thing from a mental health standpoint, just to be clear. I mean, like there's a lot of work that I've had to do with my psychologist after the fact to like unpack all of that and address it in the way that it needs to be. But I think, part of it was naturally occurring, and then a lot of it was just like learned in the moment because like you can't survive you can't survive and Emerge at times if you can't turn that emotional piece off, because like you need to be able to think about things objectively.
I just think about that. I mean, normally with Emerge, you see the burnout rates with the pandemic and the immense pressures on the system, people being sicker for all the reasons that you mentioned, when you mentioned about that switch, I remember that I did rural emerge for a long time, a little bit of time before actually starting here at the U of A. And I remember that switch, but given all the pressures from the pandemic, and it's not just emergency physicians, you're talking about nurses, you're talking about respiratory, you're talking about any of the allied healthcare professionals, all the healthcare professionals that are actually propping up our healthcare system at the moment, especially in emerge, they have to do that switch too, right? When you have to constantly switch on and off, on and off, on and off, and it gets bigger and more drastic, like that is going to have an immense impact on your mental health. Immense.
It makes the rest of your life very challenging.
Yeah, that's what I was thinking.
Two young kids at home and a husband, right? And during the worst part of the pandemic, I felt like a shell of a human going home every day, which is not fair to my family. It's not fair to me, if I'm being totally honest, right? And it was a lot of work and recovery that's an ongoing process to try to manage that and prevent it from happening again. But the system, the way that it's set up right now is set up to fail healthcare workers and to fail patients. That's where we're at right now, unfortunately.
Agreed.
If we switch gears or a hard turn,
segue.
Let's do
segue.
Let's do it.
If we put aside for a moment the challenges, which are really valid, so I don't want to diminish them by any means, but can you share any stories that highlight a high point of working in the ER, especially during a crisis? So something really positive and uplifting that may have happened.
Yeah, there's a patient that comes to mind recently. I'll be vague about it, obviously, for confidentiality reasons. But at the Royal Alex, we see a lot of inner city patients, a lot who are unhoused, have very challenging social circumstances. Many or almost all of which are often out of their control. Right? It really gives you being in an inner city emerge really gives you a good sense of privilege and privileges that you have versus what other people don't have access to, right? And so I remember having this patient that came in, and I overheard them talking to someone on the phone, and it became clear that it was their birthday. And they were going to be discharged. They were pleasant the entire time. And most of the patients that I see who are unhoused and facing big kind of social discrimination and social pressures, they are often so kind and just looking for a little bit of help, right?
Right.
And so I learnred that it was their birthday, and I had a moment to make an impact, right? I was busy. There were 10 people in beds to see, and I decided that I was going to go run down and get a donut for them because just to
awesome.
make an impact on their day. And then that filled my cup too, right?
Yeah.
That I got to do something good for someone that I certainly didn't have to. I treated them medically and arranged whatever they needed.
Yeah.
It made their day. It made me happy for the rest of my shift to be able to turn my outlook around, and lots of little things like that where pausing and remembering that we're all human, that the person in front of us isn't just, numbers or results or a case.
Yeah.
I think goes a long way for all of us in Emerge to just be able to continue.
Yeah. I'm sure it made more than their day, if we're honest.
I hope so.
Yeah.
So for our listeners, what can they do to better prepare for respiratory virus season? So any preventative measures they should take, and thinking about not just themselves getting sick, but understanding how to protect themselves and others as well.
So get your influenza and COVID vaccine. We know that not only can prevent the illness, but can decrease the severity of it in a significant way. Stay at home if you're sick, right? That was one of the things that was so great during the pandemic, that everybody was so good about taking care of each other for a period of time. Where people would look at you sideways if you were sniffling outside, right? And so just be a good neighbor, be a good human.
Whereas before it was like a badge of honor.
Exactly.
Like you're so sick, but you're still coming into work.
Yeah, exactly. You're totally right. And like, we need to like take that lesson learned from the pandemic. We should not be out and about and getting people sick when we're not feeling well. So stay home if you're sick, lots of hand washing, get vaccinated, mask up, right? So we know that a lot of these respiratory viruses are either like droplet or airborne spread. And so, like just using very basic public health measures, and like lots of just like common sense, like be a good neighbor and don't get people around you sick. If you're, another thing that, if you have a newborn, for me personally, like in that first 28 days, like be really cautious about who you're letting around you and your newborn, because I also work in pediatrics, and boy, can those kids get really, really sick.
Oh my gosh.
Yeah. RSV is another virus that we haven't mentioned, but that is really particularly bad in like really young kids and babies and the elderly population, right? And that also has a vaccine associated with it with certain populations. So, and then also just like maybe don't go visit your friend that has a newborn until they're a little older.
Yeah.
Yeah. Like, and like,
there's time. There's like, time. You can still see them when they're small, just not that small.
Yeah, exactly. Exactly.
Not to wade into the mask, because, Shereen and I were masking for quite a bit longer than anybody else. And I remember that I'm going to be brutally honest. The reason I stopped is because I wasn't getting sick from anything outside of my two kids who are under the age of 5, because they're going to daycare without any masks on. So no matter what I would do, I would wear a mask everywhere, N95. I still wear a mask on the plane. If it's really crowded, I'll wear a mask like N95s. Oh man, I was just getting hit from daycare colds, probably COVID at some point in time. Although I don't think I ever tested positive for it. What about masks and hand sanitizer? What do you do? What do you see a lot of your colleagues do?
There's hand sanitizer in my purse right now. Yeah. So I have like hand sanitizer in my car, hand sanitizer in all my purses and backpacks. The rule when my kids walk in the door is wash your hands. They roll their eyes at me every time. I'm like, guys, we've been doing this for like 4 years. Why is it still a surprise to you that the first thing you do is go to the sink and we all wash our hands?
All kids are like that. I don't know why.
Yeah. And like I'm still wearing N95s at work. Good. Like, even though I don't necessarily have to, I just like simply don't want, being sick is terrible.
Yeah.
I don't want to get sick. I want to be able to continue to like be healthy and live my life and go for a run when I want to go for a run without being sick. Right. Yeah. So I'm still, masking up with airborne precautions at work too.
Fantastic.
Excellent advice. Now for our most hard-hitting question of the episode. And we call this the friendship question. Dr. Mithani, what is your favorite activity, or media that you like to engage in on your downtime? Something that kind of helps you reset or relax a little bit.
Playing tennis.
Oh, awesome.
Yeah, cool. Yeah. So I, in the last like 2-ish years, have really gotten into tennis. I'm not that good, but it's like I'm enough that I can like play matches. I'm good enough that I can like play matches. So, it's like even just booking a court with like a friend or my husband and just like hitting the ball for an hour is quite cathartic. Yeah. And then like, or using it as social time too. I have a lot of friends now that play tennis or that I've met as I've been playing and learning, where we just, have one nice thing about being in emerge doc is that as a shift worker, you have like random days off in the middle of the week. Right. Mm-hmm. And so I have the ability to just like book a court and play with my friends. And it's great. It's like a nice social activity, a bonding activity, and you get exercise in it. The best exercise is the exercise you have fun doing. Right. Mm-hmm. So between tennis and ultimate frisbee, those are like my favorite two things to do.
Ultimate frisbee.
Oh yeah. Oh, I love ultimate.
How long have you been playing ultimate for?
Oh, like since I was maybe like 10 or 12 years now.
Wow.
Yeah.
That's actually, we don't, I played it in gym class and loved it.
Yeah.
But I haven't met a lot of people who do ultimate frisbee.
Oh, I love ultimate. It's like the thing that I often will say that I'll play until my body stops letting me play. Wow. It's a pretty high impact sport,
it is
right?
A very high impact sport.
Yeah, I'll play until my body says no.
Awesome. Do you like to watch tennis matches too?
I do. Now I do. Now that I play now I feel like I'm very invested in watching professional tennis matches.
Do you have a favorite player?
I really like Coco Gauff. She's pretty great.
Okay,
yeah. And she's from Tunisia. Why can't I remember her name? Ons Jabeur. Love her as well. Okay. Yeah. So there's like a Netflix series called Breakpoint where you get to kind of like learn about all these different players and like their families and like kind of how they got into tennis. The two of them are pretty great. Really like them.
Neat.
How about you, Roshan?
Oh man, so much is the problem with having two young boys under the age of 5 is that whatever guilty pleasure you have just depends on what you can actually do, right? So I kind of go back to TV usually, but I don't know if it's guilty. It's just because it's not bad TV. It's just very, I'd say, inappropriate TV, like just stuff that, you know,
like
can't
comedy?
Inappropriate comedies. Like I used to watch a lot of Robot Chicken when
I used to watch that too.
which is a very interesting show. I have matured in my taste for that guilty pleasure to now I completely binge watched while working out for the last, because there's not that many episodes. It's Always Sunny in Philadelphia.
Oh yeah, that's a good one.
I love that show.
That's hilarious.
So good. And I think that has kind of been, and it shouldn't be a guilty pleasure, but for me, with the limited time that I have, that extends to it. So I'm still trying to figure out, I just started watching Abbott Elementary, and that's not a guilty pleasure. I mean, sometimes I feel quite a bit of empathy because it talks about the struggles of teachers, although we don't work in that sort of environment, but definitely the struggle of educators.
We can relate to it.
There are some things that you can definitely relate to in Abbott Elementary, even though it's an elementary school, it's in Philly. There are different socioeconomic pressures that are there.
But students are students sometimes.
Students are students, whether they're in elementary school or they're in post-secondary education. But yeah, I mean, before the pandemic, guilty pleasure, I probably would have said, I don't know, like going to, maybe to like the racetrack.
Okay.
Yeah. Like I like go-karting and I always felt bad about like lapping like young youth.
Little kids.
Yeah. And then beating them in like laser tag right afterwards. Like that was probably my guilty pleasure before having kids.
Yeah.
Yeah. What about you, Shereen?
So I don't know. Yeah, probably is a guilty pleasure. I like, watching or listening to crime documentaries.
Oh, that's right.
So like
that's right.
Awesome. Podcasts or like shows,
like serial-esque stuff.
Yeah, like stuff like that.
What's the latest one?
So the latest one that I've been fascinated with is the Robert Tellis drama. So he's a guy in Nevada, in Las Vegas, and he was like a public official. And there was a journalist who was kind of digging up dirt on him, and then this journalist was murdered, and it was caught on camera, and a lot of the evidence points to this public official. So I've been watching the court proceedings and stuff like that. So I think I don't know if the jury has come to a verdict yet, but they were deliberating yesterday and today. So, you know, I'm just fascinated by, you know, that fine line between either doing something criminal or being a victim in some way. Like, just how can I avoid both of those things? It's really fascinating.
You'll be winning in life if you do.
You know, it's just everyday people, you know, regular lives, and then, you know, something happens. So I would say maybe that's a guilty pleasure.
Maybe we should incorporate a murder mystery into Foundations then, maybe for the review sessions.
I'm all for it. Yeah. Well, thank you very much, everybody, for sharing. And thank you, Dr. Mithani, for sharing as well. It's always great to know that our healthcare heroes have really neat interests beyond the ER.
This has definitely been an enlightening discussion. We hope our listeners found it insightful and are inspired to engage with these critical issues.
And to all our friends and curious minds out there, remember to stay tuned for next week's episode. We'll continue exploring the many facets of healthcare and medical education. If you have any questions or topics you'd like us to cover, don't hesitate to reach out.
Until next time, stay curious, stay compassionate, and keep learning. Thanks for tuning in.